what's really turned out to be 100% true is that it's the way you do your everyday activities that it causes the problem, and guess what you have to correct? The way you do your everyday activities. That's the most effective treatment. She's shown that in several studies. Is it hard? Yes. And in some ways, it turns out people don't like to do exercise. Now, there are some people that do, but the majority of people don't. In fact, Linda's studies have shown that people stop doing the exercises, even if they're coming in once a week to be monitored on their exercises. They fall off rather quickly. But if you really get them to change the way they do their everyday activities, they do that much longer. And they can associate. That was always been the way I tried to approach patients. I never wanted them to feel better unless they earned it.
Oh, that's very interesting.
No, absolutely not. And so the whole method was you show them how to move so it doesn't hurt.
So tell me that psychology, that you never want them to feel better unless they've earned it. So tell me more. That's very interesting.
Well, I mean, so for example, people would have been to other physical therapists and they say, well, the other physical therapist put that nice heat on me and they did these other things. And I'm like, it obviously didn't work. You're cooked enough and here you are still needing help. So I'm not going to do anything to make you feel better unless you earn it.
Oh, that is great. I love that.
No, it's true.
And it actually leads me to a question that I was going to save for later, but I think is a good one to ask you now, which would be, what are your thoughts on chiropractors?
They aren't good. I mean, the big reason is, and there's a whole thing in physical therapy called manipulative therapy, or sometimes it's also called manual therapy, though that's including many more things than manipulation as such. It just as chiropractics does too. What never made sense to me was that you could go in and somebody would push on something and then you would be well, because it doesn't address how did it get that way and what are you going to do to keep it from getting that way again. I mean, those things just never made sense to me. And then there were two schools of thought in chiropractics. I don't know whether you know that. They call them straights and mixers. Well, the straights were ones that believed that if your spine was out of alignment, you would push on the nerve that went to your pancreas, and that's how you got diabetes.
Oh, okay. I have heard of that.
Okay,
yes.
So it was a real that all of your disease problems were related to the spinal alignment and impeding nerves and nerve function.
And that doesn't fly with the neurobiologist.
and then the mixers were ones that saw it as more musculoskeletal related. They didn't mix in other kinds of diseases. But chiropractors, see, that was the other problem, is chiropractors would use physical therapy because that was a generic definition of physical therapy as a physical modality. Well, and that's, of course, where we were known for, were the use of physical agents, And again, if you go back far enough before pain pills and anti-inflammatories, etc., which have to get another look-see now, using physical modalities was what we did. Hot packs, cold packs. There was even a thing called diathermy. I just saw it before.
Oh, that's what you did in physical therapy in the beginning.
Beginning, well, when people had pain problems in the musculoskeletal world, you would use some kind of physical agent, hot packs, cold packs, ultrasound, diathermy, to try to relieve the pain. And in those days, you kind of thought if the pain went away, then everything was healed. Well, it didn't take me a whole lot of years to sort of figure out, no, you still have the same problem. You're just taking away the symptoms doesn't fix the problem. And that's why I've been trying to promote the idea we can address cause while physicians take care of consequence and symptoms.